Hi, I'm Dr. Michael Mayer. I'm a licensed psychologist and a Qigong teacher. I combine both Eastern and Western methods in my work in both my private practice and at the integrated medical clinic that I co-founded. What I want to share with you today is an approach to chronic pain, because there's so many people that come into our clinic or in my private practice that I meet that are suffering with chronic pain and go into medication. And there's a lot of medications that are used and that can help for a while, but many of them become addictive. So according to the precautionary principle, it's always best to use the least amount of something that can be potentially detrimental first before you move up to those stronger medications that are on the market. With most of the patients that I work with, they don't even need those medications. So I want to share with you what some of those methods are. Let me do that by sharing a story with you about a patient who had her leg crushed in a car accident, and the jaws of life needed to come in, and her leg was crushed. She was a nurse at a local hospital. And she started to get addicted to pain medication before her attorney referred her to me. And then when she came in to see me, she was in a lot of pain because I asked her to reduce her medication a little bit. And when she came in, she was basically talking about how she might lose her job as a nurse. And she was hobbling around on the floor of, when she'd be seeing patients. She couldn't walk very well and was limping. So as I worked with her, what I did was I taught her a method that I developed that kind of comes from pain transferal in the Western tradition. In the East, I call it the yin-yang balancing method. What that means is that what you do is you touch a place that's opposite to the place that hurts. So she was, the right side of her leg was hurting, of her ankle, and I had her touch and press on the left point to make that hurt. And so then I had her do that with the right side to the other side of her leg. It was her right leg that was problematic, and I had her touch the left side. Now, while I'm doing all this, I'm working with a process that's called medical hypnosis. And the thing that I've introduced to the literature of medical hypnosis is a process that I've developed from Qigong that has to do with noticing the breath come up your back and then down the front of your body on your out-breath. So on your in-breath, up your back, and you create a trance state that way, and you can begin to wash over pain. But you're not trying to get rid of the pain, because that gets you into a place of trying. So this is a way of activating the parasympathetic nervous system to really help that kind of healing energy to come. And then after that, you can touch a place either above, below, or to one side or the other, and you make that other place hurt, equal to the hurt that's on the other side, to transfer the pain. So when I did that with her, she transferred the pain over to the other side, and I introduced the post-hypnotic suggestion that it was her left leg that was in the accident, not the right. And she felt that there was pain in her left side, and I asked her on a SUD scale. SUDS means Subjective Units of Distress Scale. It's a basic measure in behavioral healthcare to communicate between a patient and a doctor as to how strong your pain is. She said that in this session, her pain went down from an 8 to a 3. That was our first session on her right side. Now, some of my colleagues criticized me and said, look, you shouldn't ever be creating pain in any place. And I explained to them that this is to help the person to realize that the mind is very much affects the way that the pain is. And if you really do this particular method of pain transferal, you're going to start to see, wow, it was my mind that was partly creating the pain there. So in our very first session, she reduced it to 3. And after 2 or 3 sessions, she was able to bring down her pain using this River of Life method down to a 0, a SUD scale. And within 6 sessions, she was able to go back to work and do this on her own. So these kinds of methods I've used to help people with a wide variety of pain syndromes. You can try it yourself. Always get a consult with a doctor to make sure that you're not avoiding some kind of medical treatment that might be needed. But this is a really important adjunct to medical treatment that we use up in our clinic. This is an integrated medical clinic that I work with, and that you can try on your own when you have some kind of pain. If things get really difficult for you, I do body-mind health coaching with people all over the country. You can find information on that on my website, bodymindhealing.com. And so I work with a wide variety of pain conditions, acute accidents, as well as more psychological and other kinds of pain. And for those deeper kinds of pains that are psychologically oriented, I use Dr. Eugene Genlin's focusing method to go into the crux of what somebody's in pain about until they feel a felt shift. And so this is all part of my body-mind healing psychotherapy method. If you'd like to learn more about it in depth, you can see my book online, Body-Mind Healing Psychotherapy, to learn more about the breadth and depth of the tradition. So I hope this is helpful to you in whatever your pain is. And remember, there's a distinction between healing and curing. Healing is your relationship to the pain, so that you use this to have a compassionate relationship to it. You put a hand on your heart and your hand on your belly as you're doing the River of Life practice. And so you can imagine that the pain that you have is like an ice block, or however you like to imagine it. And you imagine the compassionate light of the sun shining on the ice to melt it and to turn ice into water vapor, to come up back into the sky and come down and beginning to wash the river, with no attachment to changing the pain, just to find this healing relationship to it. For many people, then this does cure it, but the more you have the attachment to curing it, then you're going to feel frustrated and you're not going to be in a mindfulness meditation relationship to the pain. So I hope to have contact with you, and you can always email me at drmichael@bodymindhealing.com to answer any questions you might have. Thank you.